Good afternoon. I'm Beth Stewart, and on behalf of the Texas Oral Health Coalition, would like to welcome you all to the second webinar in our three-part series on teledentistry in Texas. After teledentistry passed during the 87th Texas legislative session, we found a need to provide information on the nuts and bolts of teledentistry implementation in Texas. We're extremely pleased to offer this virtual learning series for Texas dental licensees and excited to present today's webinar entitled Selection of Teledentistry Platforms and Utilization in Alternative Care Settings. I'm also very pleased to announce the Teledentistry in Texas Guide is now available to view or download from our website. We've included a short checklist and a teledentistry informed consent template you are welcome to use. Dental providers may earn 1 hour of continuing dental education credit for submitting the completed online evaluation. Our presenter today is Dr. McAlister Castelaz, who is a dental public health resident with experience providing care in federally qualified health centers. Previously, she worked as a lead dentist at a community health center in Wisconsin and dental director of a community health center in Virginia. She has developed resources for the safety net dental community to implement teledentistry. She is an active advocate for alternative care models, including teledentistry and mobile dentistry. Dr. Castelaz currently serves as the president of the American Mobile and Teledentistry Alliance. So without further ado, please welcome Dr. Castelaz.
Thank you so much for that lovely introduction, Beth. Hello, everyone, and I'm super excited to have you all with us this afternoon over a lunch. I'm going to go ahead and share my screen and let me get some slides pulled up and we'll jump right into it, okay? Wonderful. All right, so this afternoon, we'll be talking about the selection of teledentistry platforms and the utilization in an alternative care setting. So 3 learning objectives that we do have for this afternoon is first, we want to be able to, at the end of this presentation, identify selection criteria of available teledentistry platforms, be able to review standards of care when providing care via teledentistry, and then we're also going to discuss the utilization of teledentistry in an alternative care setting. So just wanted to kind of get us all onto the same page. So teledentistry falls under that large umbrella of telehealth, which we saw really came to the forefront of healthcare during the COVID-19 pandemic. And we start to look for these opportunities to engage with our patients in less traditional settings, especially virtually, where we were facing challenges with coming face-to-face. And teledentistry is one of those ways that we are able to engage with our patients. So what is teledentistry? It's the utilization of technology to provide dental care, education, and consultation through virtual platforms. I do want to emphasize that it's not a specialty, it's simply a change in modality of how care is delivered. So it has to be held to the same standard of care as in-person care, which means if you are not licensed or it's not within your scope to provide a certain service, you aren't going to be doing it. So as dentists, you're not talking to your patients through how to do an extraction at home. You're not having your dental assistant do scaling outside of their own scope. It has to be within your scope of practice. So it doesn't change, again, what you're able to do, it just changes how you're delivering the care. So I just like to emphasize that. I believe you all heard from Jamie the other month, and she kind of went through some of the billing aspects of teledentistry. And just want to remind everyone that there are 2 ways that teledentistry happens. We have synchronous encounters. So they are our real-time encounters with the dentist using both video and audio components, versus an asynchronous encounter, which some people call store forward, in which information, including any images, is collected, stored, and then sent to the dentist for review at a later date and time. The easiest way that I like to think of it is a synchronous encounter is getting to FaceTime your patient, and a asynchronous encounter is texting back and forth with pictures. That being said, it's a little bit more complex than that, but that's just kind of how we differentiate between those 2. So in terms of synchronous encounters, I just wanted to review some of the benefits and challenges using synchronous and asynchronous, because this is going to help us understand how we want to approach selection criteria for our teledentistry platforms, and then how you're planning to utilize teledentistry in your practice. So Synchronous encounters are going to feel the most similar to an in-person visit. You get to talk face-to-face with your patients. It allows for real-time observation of patient signs and symptoms and allows for real-time discussion. That being said, it does require to have good quality connectivity, so your video or your audio isn't lagging, that you have quality technology, that you can get clear images on your video and clear audio. And it does require some tech savviness on behalf of both you, the user of as the dentist, the user of the teledentistry platform, as well as your patient who is using that as well. So just kind of thinking about those times where you might talk to a family member who isn't familiar with their phone, and maybe you're talking to their ear instead of their face or the top half of their forehead. So just understanding that there is some tech savviness that has to come with this. That being said, there are a lot of tools out there that can help coach not just yourself as the clinician, but also your patients as well on how to be successful with those types of appointments. Now for asynchronous encounters, some of the benefits include we're not going to be as reliant on good connectivity, so we don't have to worry about your video, your audio lagging in the same way because you're just sending images and text. You're able to provide at-home guides to help patients in obtaining quality and necessary images. I believe Beth, you actually might have one or two of those included as a resource in the guide that you helped develop for Texas Oral Health Coalition. So it's definitely a really great resource. Again, some of the challenges though, there's still some tech savviness that does happen with this. Yes, you can send a home guide, but you need to make sure that whoever is utilizing that they are able to capture the image that you're looking for, that they're using quality technology, that they can get a clear image for you. And there's going to be a delay in time when answering questions, reviewing findings, and having discussion with your patient because it's happening asynchronously. You don't get to talk back and forth in the same way. So just understanding that and knowing that those challenges exist, this can help you also decide when you might need to switch from even a teledentistry encounter to getting to in-person care. However, this can really help with some of the triage aspects. So we'll get into that in just a little bit as well. But I just wanted to highlight here, there's a lot of teledentistry platforms. This slide by no means is a complete picture of them all. These are just some ones that are a little bit more popular right now. Do want to emphasize, I'm not endorsing any of them in particular. What I want to do is just give you an idea that there's a lot out there and they all have different benefits and different challenges that come with them. And what I want to do then is to kind of get into some of those platform considerations with everyone. So thinking about, great, you want to do teledentistry, but of all those platforms, which one's going to be best for you and for your patient? So the first thing that I want to emphasize when considering any teledentistry platform is HIPAA compliance. Regardless of whatever platform you settle on and whatever one you want to utilize, you still need to make sure that it's HIPAA compliant. This is still healthcare. You are still having to protect your patients' privacy and their rights. So always ensure that you are going to have that secure end-to-end encryption, that the platform that you are utilizing will be HIPAA compliant. The next thing that you should be considering is looking for platforms that are going to be more dentally oriented. There's a lot, if you think there are a lot of teledentistry platforms, there are a lot of really broad telehealth platforms as well. And because telehealth is so much more broad, it might not be as dentally specific. And it's going to, while it maybe will be HIPAA compliant, it's not going to have that same ability for you to share an accurate dental treatment plan or a chart or categorize things the way you want to, or put your billing codes in. So looking for ones that are dentally oriented and looking at ones that have been providing teledentistry services for a period of time. Now, I know that teledentistry kind of really picked up speed in 2020 because of COVID. However, there are a lot of platforms prior to 2020 that were already being utilized for teledentistry that were specifically developed as teledentistry platforms. So definitely find out how long those platforms have been offering teledentistry services, what type of IT support they have, what type of technical support they're going to have for you. You should also be considering any opportunities to be able to integrate this platform with your electronic dental record or maybe even the broader electronic health record. It's not super common yet. However, there are some platforms that you are now seeing the ability to integrate with, say, Dentrix or EagleSoft or other EDR options. For a while, your teledentistry platform was going to have to be a separate software, a separate system from your dental record. However, as we've seen teledentistry start to pick up speed, we start to see some of these teledentistry companies partnering with electronic dental record companies, allowing for a more integrated approach, which could just aid all of that in creating a really complete dental record. So find out if there's any integration opportunity. And say if you're already using Dentrix in your practice, then is there an opportunity for that platform to be integrated with Dentrix? So definitely worth considering that. Consider your patient's experience with the platform. Is it going to be user-friendly for them? Will it be easy for them to navigate? There's nothing more stressful I have found when trying to get onto a virtual appointment with my doctor where you don't know, making sure that you get into the right part of the portal, that you have your video on or the chat's working. So making sure that's going to be user-friendly to the patient, but it should also be user-friendly to you as the provider. It should be easy for you to navigate. A lot of teledentistry platforms have opportunities to include like dental charts in there and images, and have you draw on the images so you can send those to your patient. So how easy is it to navigate those other tools in there, and that you are going to be able to use that full scope of offers that platform has. So not only should it be beneficial and a positive experience for your patient, but you shouldn't get frustrated utilizing it as well. Along that line, kind of as a subform under the patient experience and the provider experience, thinking about form accessibility and usability, remembering that we do need to have informed consent prior to teledentistry appointment. So does that platform have an opportunity for you to have an informed consent uploaded that can be reviewed and electronically signed and saved for that patient? Is there an opportunity for you to put a health history in there for your patient to fill out prior to their teledentistry appointment? How much stuff can you get into that platform that you are going to need to make that appointment run as smoothly as possible? So by the time, if you're using, say, a synchronous encounter, you and your patient, when you're both logging on, that you can just get right into the actual teledentistry appointment. You're not spending a lot of time going through and filling out their medical history with them, that you're going through with all the consents with them. Thinking about, just again, how you want to efficiently run when you're in-person care, what features does that platform have that's going to allow you to still have an efficient appointment, even being virtual? When it comes to those platforms as well, how well can you switch between a synchronous encounter and an asynchronous encounter? Do they have capabilities for live video chat? Do they have capabilities for being able to send images and text messages or emails to one another through a secure portal? There are some platforms that are going to be much more prone to being able to utilize just that asynchronous, where you have patients that can upload a photo, send in a text, and that you're able to then reply to that, but they don't have, I apologize, not there yet, but they don't have as strong of an opportunity for a synchronous encounter, that you do want to get on and talk to that patient face to face. So just taking that into consideration. And there's a lot of really great opportunity for both synchronous and asynchronous encounters in those alternative care settings, which we'll get into. So just thinking about how much you want to rely on those different types of encounters and be able to switch between those two for yourself and your patients. Another thing to consider with your platform utilization, is there a way for you to collect payment for services provided via teledentistry? Is it something that's going to have to come through a separate billing department for you? Is there a way that you can collect payment as part of the platform? So just another kind of stop in that way and how you are delivering care as well. And then the last thing that you should be considering is the cost of the platform. They have it's a pretty wide range of how much they cost. And then within those platforms themselves, you will see that some will utilize a subscription-based model, some will utilize more of a monthly subscription versus a yearly subscription. It might be that they're different tiers, so depending on what you want to be able to do in that platform, you can add or subtract, kind of like how other electronic dental records work, is depending on how fancy and whatever other add-ons you want to utilize, that is also available for teledentistry platforms. So thinking about cost-wise, how much are you interested and able to spend on that? And then what is going to be the most valuable investment in those extra features that you could take advantage of? So to help with that, this was back in 2020 when everyone kind of started to get really interested in teledentistry. I actually went in, and this is a Google form, which I have emailed Beth the link, so I believe she's going to get that shared to all of our attendees and up on the website. But what I did was, in this, it's all those different criteria that I was just going over, is I put them all into a Google form and then looked at different platforms and started answering yes, no, putting in some descriptions just to help paint a better picture. I'm such a visual person that this was really helpful for me with, as I was either making recommendations to other safety net clinics or helping them kind of navigate their choices. This was a really great way to provide just kind of a quick visual of who they might want to start reaching out to right away. And be able to start exploring that as a platform that they might be interested in investing in. So that will be, I believe we'll get that available for you. Myself and then a handful of my other colleagues at the American Mobile and Teledentistry Alliance do help manage this, and we do try to update it periodically, especially as new platforms come about or changes to other platforms happen. So it is a living document. All right. So now we've kind of thought about the platform itself when it comes to teledentistry, but what happens with, so you've picked your platform, you know what you want to use. Well, now you want to start to utilize teledentistry in your practice. So these are some things that you should be considering if you want to start adopting teledentistry as an additional service to your practice. This was just some basic questions that you should start off asking yourself before you even get into the actual program development. First of all, what is your level of need? Do you have a lot of patients who are going to be taking advantage of teledentistry? Is it going to be a really wide patient population? Are we talking about children through adults? Are you going to be looking specifically at children, specifically at adults in a long-term care facility? What is the level of need, and how frequently will you be utilizing teledentistry? A daily basis, a weekly basis, a monthly basis? Is this something that happens every day that's an added service in your day-to-day? Or is it you're doing a specific program once a month, once a week, and you want to be using teledentistry for it? What does that teledentistry access look like for your patients? Kind of along that same level of need. How often are you going to be engaging with your patients via teledentistry? Is this a way for you to be doing follow-up care on a day-to-day basis for your patients? Is this that you've been contracted with another entity that you're going to be providing services via teledentistry? So how are your patients going to be utilizing the teledentistry? Is it the patient themselves? Is it their caregiver? Is it a parent? Is it a teacher? How is that teledentistry going to be utilized on the patient end? Again, what's the cost of adding a teledentistry service to your practice? Is it just teledentistry? Are you using it in tandem with a mobile practice? What other considerations do you have when it comes to the actual cost of the software, of the training of your staff, of your team on being able to use teledentistry? So how much is it going to cost you for that? For my friends who are in community health centers, do you have buy-in from your leadership? Are they going to be willing to make this investment with you to add this as a service to your health center? Do you have buy-in from your staff? Are your staff excited about this? If your staff aren't excited, it's going to be even harder to implement that. So making sure you have good buy-in from your staff, that they're going to be able to get the training that they need, that they're excited about this service, that it's something that everyone's going to be on board with. Are you going to have appropriate technical support, both from, say, the platform itself, but within your own IT department as well? So are you going to be able to troubleshoot? How are you going to troubleshoot? So knowing that you have appropriate technical support for this. And also thinking about what quality improvement strategies do you want to utilize when you adopt teledentistry services? As anytime you change a process in a clinical setting, we do like to have some sort of quality improvement in place that we can see where we're being successful and where we might need to change. So having an idea of how you want to be able to assess that teledentistry program so you can identify its strengths and weaknesses, especially if you're working with a scale-up model and you're going to start small and get bigger, which is what I always recommend to anyone who wants to implement teledentistry, is start small and scale it up. You're going to be much more successful and much less overwhelmed with implementing that. So once you kind of have answered all those questions, these are some what we call best practices when it comes to teledentistry and thinking about how those services are getting delivered. So I know this does get a little bit repetitious, and I appreciate everyone's patience with that. I just really want to make sure that some of these points get driven home. As always, virtual services are consistent with in-person services. So if you're getting an image from a patient or from your dental assistant out in the field, and it is not clear and you do not know what you're looking at, you can't diagnose something that is not going to be appropriate at that time. So you might need to switch to a in-person opportunity. So it's not the end of the road, but just remember your virtual services have to be consistent with in-person services. When we retake radiographs in the clinic practice, because say you missed part of the root and are missing a part of the little APC of the tooth, or there's too much overlap in our bite wings, you need to have good quality diagnostic imaging. That is true for teledentistry as well. Remembering that services are not offered nor billed beyond that licensed provider's scope of practice. So once again, you stay within your scope of practice. Just because it's teledentistry doesn't mean you get to do something special that you normally don't get to do. If you can't do it in person, you can't do it via teledentistry. Using delivery of clinical advice and appropriate pharmacotherapy as indicated. So again, using best practices when it comes to the clinical advice and prescriptions as well. Making sure that you have developed a workflow that's going to allow for timely and appropriate follow-up with your patients. This is especially important with those asynchronous encounters. If you have patients that are sending you images or you have a hygienist on the field that's sending you images, making sure that you're reviewing those in a timely manner, and what designates a timely manner kind of varies for everyone. I usually recommend 24 to 48 hours. But especially if there's an emergent need, making sure that everything is reviewed timely, appropriately, and that you have a plan in place for what that next step is going to look like. Always ensuring that you're utilizing appropriate technology, that you're going to be able to get quality, clear images, video, audio when you're doing consultations with a patient. This is what really helps you establish that informed provider-patient relationship for care. So again, that same theme of if it's not able to be done virtually, if it's done in person, it has to be done virtually. So making sure that you're going to be able to establish that secure patient-provider relationship as well. Again, utilizing HIPAA-compliant technologies to ensure that your patient's privacy is protected. Making sure that you document and retain comprehensive patient records within standards of your respective state dental board. Again, complete dental records, so don't eliminate anything, don't change anything. This is still a dental record. This is still a health record, so maintaining those same standards that the Texas State Board has out for you. This might seem kind of silly, but you should always remember, confirm that patient's identity and provide the patient with the dental provider's license as well. So make sure that when you're logging onto that appointment or that you are reviewing images, that those images belong to the correct patient, that you are, when you are on a synchronous call with the patient, it is who you are having the appointment with. And then it's just good practice too to have the dental provider's dental license available. I know in our clinics that information is available on the walls for our patients. So if we're on a virtual platform, just making sure that it is still available for your patients as well. Make sure that you have a relationship with any provider who's able to deliver necessary in-person care when indicated. So this is especially important for, say, a public health dental hygienist, that if you're going to be utilizing teledentistry services, that you do have a way or an opportunity for referral to a dentist or to a dental specialist if there is additional care needed for that patient beyond what you are able to provide within the scope of your own practice. And then utilizing appropriate engineering protocols to ensure patient and provider safety, especially when we're talking about teledentistry in tandem with mobile dentistry. So making sure that we are still maintaining a clean, sterile environment, that if you are utilizing a intraoral camera, that you have a protective sleeve over it that can be disposed of. So all those same infection control protocols that we like to follow in person if we're going to be in an alternative setting as well. As I said, developing quality assurance and quality insurance protocols to make sure that standard of care is met consistently. This includes any safety and efficacy and consistency with your legal and professional obligations. So just good systems practice, that you have a way that you ensure that you are going to be consistently delivering quality care to your patients, and that there's a way for you to identify weaknesses in your program and make corrections for those weaknesses. Always make sure that you obtain and document all necessary aspects of informed consent. And this includes the mutual understanding relating to limitations in delivery using telehealth rather than in-person exams. For an asynchronous model, again, that patient isn't going to get a response from you necessarily within the next 5 minutes, 10 minutes, what have you. It's not going to be an immediate response like when you get to talk face-to-face, making sure patients understand that. And then also developing a training process for all team members. So say you invest in an intraoral scanner, so training on how to use that scanner appropriately, establishing appropriate expectations and accountability for each team member's role. And then just, again, good practice, having a creative training process throughout your program as well, that there is an opportunity to retrain everyone as well, because I think we've all experienced it. Sometimes you start getting into a certain system and then you might miss something somewhere else. So making sure that you have a consistent training program, not just for new people, but for your current staff as well, to make sure everyone's staying up to date and is being as efficient with their practice as well. All righty. So we talked about all these wonderful things about we have a platform. We figured out how we're going to make sure that we provide good quality care via teledentistry. How are we going to do it now? There's actually a lot of different ways that teledentistry can be utilized. What I have on the slide here by no means is a complete picture. It's just kind of a sample of what we see it's being utilized most often as. So I'm just going to kind of go through these. And I do want to highlight too that within each of these categories, there's some subcategories as well. So one of the ways that we'll see teledentistry utilized is with limited evaluation and triage. This is really helpful in crisis and pandemic scenarios. So in COVID, when we all couldn't do in-person care, this was a really great way to be able to help triage a patient virtually and determine if they really did require something needing in-person care. For instance, say you had a patient, you were able to get in touch with the patient via teledentistry and they had a swollen tooth, they had a bad tooth. You're able to then prescribe antibiotics, and then rather than spending time having them to come in for you to first take a look and then prescribe the antibiotics and have them come back, you could go through a different process of having that initial consult, that triage done virtually. And then by the time they're showing up for in-person care, you've already done some of that management ahead of time for them. Can really help a patient understand if their needs are urgent or non-urgent and be able to, again, utilize your resources appropriately. Hygiene assessments. This could be really helpful for recall and preventive appointments as well. I have some colleagues that what they'll do is when they are maybe out of the office for their dental hygienists who are they're able to do intraoral scans and write down all the necessary clinical findings and their perio-probings, and then they can go back and review these asynchronously as part of the periodic exam for their patients. So still being able to kind of get a more complete picture for when that dentist is not necessarily available in office for a assessment. For kind of along that same line, satellite coverage. So say you have multi-sites and maybe a dentist is absent in one of them, being able to do some more outreach this way, being able to expand your market share or increasing quality of life factors for your staff as well. So having this opportunity that you might have a main clinic site, but you could have these satellite clinics that aren't necessarily always staffed with an in-person dentist, but utilizing general supervision via teledentistry as a way to increase access to some of those preventive services. Consultations. This can be a really great way to help follow up with patients as well regarding treatment plans. You have this really great opportunity to use images, not just say their x-rays or show them their tooth chart, but pictures and these images you can circle and draw on them. And patients can be so much more receptive to understanding the recommendations that you're making. Or say you're working with a school and you see a child and you want to communicate to mom and dad the importance of getting that child back for dental treatment, being able to use those pictures and be able to communicate via a secure platform can really help parents understand why you're recommending the treatment that you are for their child. other end of the spectrum too, for our individuals in long-term care facilities who maybe rely on caregivers, this is another great way to be able to communicate dental need to those caregivers to help them make informed decision for their loved ones in long-term care. Our teledentistry can help enhance our referral system. So say you have a patient who comes in that has an unusual lesion on their tongue, their cheek, what have you, and you want to send them to the oral surgeon. You can take a picture, you can send so much more information to that oral surgeon, and they're able to provide a virtual consultation. There's been some research studies out of, there's one down in Brazil, and we've seen it in a couple other countries as well, that they found the need for in-person diagnosis decreased by, I want to say it was about 36% by utilizing these virtual consultations as well. So those patients that had transportation challenges, you were able to overcome that barrier because they didn't have to be transported. And I do want to emphasize that not only were they decreasing the need for the in-person consultation, that the virtual consultations were as clinically accurate as they were in person. So you weren't losing out on that quality as well. It was still quality consultation that was happening virtually. So I do want to emphasize that as well. And finally, public health programs. We see a lot of community health centers, a lot of outreach programs that have really embraced teledentistry. These are people who are really excited about embracing teledentistry in an alternative care setting. So let's kind of get into what that actually looks like then. I did want to emphasize too that teledentistry will often be utilized in tandem with mobile dentistry. On the slide here, just a couple examples of what that looks like with a few different organizations. I do want to emphasize, though, that teledentistry and mobile dentistry are two different things. They will often be utilized together, but making sure that you follow not just your teledentistry rules and regulations in your state, but also the mobile dentistry rules and regulations within your state. So while they'll often use in tandem, that there might be different rules or other considerations that you need to follow. So making sure you have the appropriate mobile permits, that you are following what Texas specifically specifies for a mobile dental program, in addition to what you're going to be able to provide via teledentistry using a mobile clinic, which is something to consider with that. Okay, so two big settings I did want to emphasize that we see often happening, especially when it comes to public outreach and public health programs, teledentistry and school-based programs, and then teledentistry and long-term care facilities. And you're actually going to see there's a lot of overlap between the two of them. I do want to emphasize that teledentistry and school-based programs is where we've seen a lot of research, a lot of got embraced very, very quickly. For anyone who is familiar, Dr. Paul Glassman's virtual dental home out in California, that model has had several decades of success. And he's demonstrated that I believe it was about 2/3 of school-age children within this virtual dental home were able to be managed by a public health dental hygienist in the field, in the school, working with a remote dentist. So there's this opportunity to decrease wait time for receiving preventive services for our children. So getting scaling and prophylaxis done for them, getting fluoride varnish, getting sealants on the teeth, that rather than having to take that child out of the school, that if there's an opportunity to place your dental hygienist in the school, not only are they able to provide those preventive services, but you can also improve your the frequency and the ability to diagnose dental disease. So having that child come in that you see there's some black spots, there's some areas of suspicious decay on there, that you're able to then look and say, yes, that child does need some additional care. There are some schools too, some opportunities as well to improve triage and referral of dental need as well. While not necessarily a school-specific program, at my current university, they actually use synchronous teledentistry to help triage when it comes to behavior management for the children. And especially for those kids that have to drive further to come to the university for care, that they're able to look and see, is there going to be a behavior challenge? Maybe they should be being prepared for sedation for an operating room. So rather than having mom and dad drive several hours for multiple appointments, making that much more efficient. So when they're coming in, they're going to get right to the appropriate care for that child as well. So opportunity using teledentistry within those settings as well. Switching to the other end of the spectrum with our older patient population or patients in long-term care facilities. Again, same idea of being able to decrease wait time in receiving preventive services and an examination by the dentist, and being able to diagnose any sort of pathology or dental disease as well. So increasing that access, because we do know that there isn't a lot of information about the actual oral health status and the oral health needs of a lot of our long-term care facility residents. And that's because not enough people are being able to, dentists aren't in the long-term care facility making those assessments. And those patients face transportation challenges and other barriers to care that prevent them from being able to access the dentist regularly. So being able to use this as a way to get that dentist, if not in person, virtually present in those facilities as well, to take a look at those patients, look at their dental needs, look at their oral health function. We've seen some research that has been demonstrated teledentistry's benefit in being able to assess a chewing function and chewing capacity of our long-term care facility residents. So being able to do other services directly for the patients. And then on a more indirect line, when it comes to long-term care facilities, teledentistry can actually be used to help provide support and education to the nursing staff and caregivers. We do see in the literature too, that our nursing staff is often uncomfortable with providing oral health services. And if their charge, that resident is resistant, they're just going to kind of give up and move on to the next thing they have to do for them. But they don't know how, they don't feel comfortable with, well, how do I help my resident brush their teeth? How are there other tools that I could be using to improve their oral health at home? So you could have this opportunity for synchronous teledentistry as a collaborative process where you can send like toolkits to your to a long-term care facility and have this opportunity to help coach and teach the nursing staff and caregivers on how to utilize those care tools. Everyone who's seen those toothbrushes with like the really thick handle that's easier for maybe an arthritic patient to grasp, or even maybe for someone else who's helping another adult brush teeth, how to effectively use those toothbrushes, how to safely use at-home mouth props to keep them open. So you have this great opportunity to help coach and improve the caregiver's ability to provide oral health to the residents as well. And then also from a educational standpoint, beyond just providing toothbrushing, helping them understand when is something concerning or not concerning for a resident, helping to do that triage with them as well. I have a colleague who works with their long-term care that they're able to through a secure portal, she can help them triage and determine, yes, we do need to get there sooner for that resident, or no, you can do X, Y, Z for the resident at this time. So there's an opportunity to help educate and improve understanding of oral health need and make sure that those caregivers and the nursing staff can be good advocates for their residents as well, utilizing teledentistry. I did want to highlight too, just 3 kind of resources that exist on the internet as well, developed from a couple other organizations that outline some best practice and promising practice approaches for different clinics and for different programs throughout the country. I do want to emphasize that these are going to be from a lot of different states. So depending on regulations, rules and regulations from that state dental board and what's available there, might not always be applicable to you, but these can provide some really valuable framework in helping you develop that program. I'm a big fan of don't reinvent the wheel if you don't have to, but this is a really great way to look and see what other people are doing, what's worked well for them, and also what they would wish they could do, or what they have identified as weaknesses in their program and what they'd like to be able to improve as well. So just some references and some readings as well. And I believe Beth said that we'll have this available for you, so you can always peruse this at your leisure as well. Just some current research. One thing that I do want to emphasize too, is we do see a lot of emerging research as well that's demonstrating that our diagnosis via teledentistry, because with improving technology and appropriate training programs, diagnosis can be just as valuable via teledentistry as in person. So I do want to emphasize, though, that it does require good technology and good training with that. So just keep that in mind. But it is definitely something that is possible, and the literature is supportive of that as well. Any questions at all? Thank you so much for your time. I know that was a lot, and I wanted to make sure I had some time at the end for anyone to ask questions.
Well, thank you, Dr. Castelaz. That was really a very informative presentation. Thank you so much. We'll give a minute or two for people to type in their questions in the Q&A or chat box. Again, you can click on that raise hand feature, and we will unmute you so you can ask your questions verbally. So as you're typing in your questions or thinking of your questions, I'll go ahead and hit you with one. Going back to the different platforms, now, is Zoom a HIPAA compliant platform that doctors can use with their patients?
I remember during COVID that they did have some HIPAA compliant end-to-end encryption. However, because Zoom was not developed as a healthcare specific platform, I would not recommend using Zoom in that capacity. For when we were in that emergency, kind of a different story, but because Zoom wasn't necessarily developed in that way, while they do have some end-to-end encryption available, the general consensus is it's not the best selection when it comes to HIPAA compliance. You should be looking, if it's not going to be a dental oriented, at a telehealth specific platform.
So it would be extremely limited in what you could do it, how you could utilize that. So if you're going to invest in something, you might as well be something that, will it take dental records? Will it do all this other and integrate?
Yes, definitely.
I mean, that would be the ideal way to go, probably.
Yes, definitely. I do understand and appreciate wanting to be smart with your money, but to a degree, like you're going to make the investment be a good investment.
Exactly. Let's see, what else? Does anyone else have any questions? Let me see what's in the Q&A box. She was just saying this is excellent. Thank you for sharing. It was that handout about the platforms, that resource.
Oh, wonderful.
So that was good.
Yeah.
And again, a quick reminder that we have a lot of this information, the guide and the other information that the coalition's developed is on the website, and we can enter the link again if you're not able to see it in the chat box, but it's further up in the chat box about the teledentistry guide to go to that special page. Do we have any raised hands? Well, I guess it was so informative. People don't have questions. This is very unusual, very unusual.
It was, I know it's a lot of information to try to cram it in within that hour or two. So,
but this is exactly what we were needing to know. And I think, this is part of it. And this is what we were needing to know, because there is so much out there about these different platforms. And do you spend thousands and thousands of dollars if it's not something that you're going to utilize? I mean, it may be something that you only want, some dentists may just want to have that service for patients with emergencies, to send a picture or something like that. And then you may have other dentists that say, ooh, we want to kind of tie this in with maybe some prevention, and have a hygienist out there doing and working in that area as well. Is there anything that you can share about, I'm not sure what states, I know you've worked in several different states, about how that might look.
Definitely. That's a really excellent question, actually. So as you kind of just point out there, Beth, there's a really wide spectrum of how we embrace teledentistry and how you are going to want to incorporate it into your practice. So I have a colleague down in Florida who she actually developed her own application, it's HIPAA compliant application for her practice, and she utilizes it primarily for just emergencies, for ways for her patients, for members of her community. And then she also actually works with a reservation a few hours away from her as well. So she utilizes that primarily for like emergency triage and for follow-up with her patients. She actually she started doing this pretty recently, and she's had a lot of great success. She's been using this as an opportunity for like a first visit for the children as well. So rather than having them be really overwhelmed and kind of nervous about coming into the dental office in the first time, especially with everyone's varying levels of PPE that we wear and how your clinic approaches that. She has this opportunity to get on a virtual call with the child, with mom, with dad, with whomever, and they all can see each other face to face. So then it's a kind of a nice introduction as a way to ease into, you're going to meet someone new and this is who it is. So she's really embraced that, not just for emergency, but even for just helping kind of introduce herself and her practice. So really great way to kind of help with recruitment as well and get new patients familiar and oriented to your practice. And then all the way at that kind of other end of the spectrum, there are programs that I've seen that you have a dental hygienist and they have all this portable equipment. They have, say, a Nomad for x-rays, they have a portable chair, all this stuff that they're then bringing with them to a long-term care facility. And then while they're at the long-term care facility, they are able to take these intraoral images and send those to the dentist. So while the dentist is at the clinic providing in-person care to other patients, they can then go back and asynchronously review that data collected by that dental hygienist and then help triage some of those patients and be able to determine, oh, if there's an opportunity for that dental hygienist to, and again, this depends on your state, but the dental hygienist can apply silver diamine fluoride, that next time that she's there, she can put some SDF on that patient's tooth. Or does that patient, do we need to come up with a plan to figure out how to get that patient transported to the dental clinic because they need a tooth out, because there's something that has to be performed by the dentist. So opportunity for triage with that. I don't know if Dr. Hall is going to talk about it at all next month, so I don't want to take his thunder too much, but I do want to highlight what I thought was really interesting, what he does at AT still with the dental students. They work with juvenile detention facilities too, and being able to do care via teledentistry for individuals who might be in juvenile detention facilities or incarcerated, that again, you have this challenge of dental care in person there. So you can do some virtual triage and be able to prioritize the care that you are able to deliver. It's a really great way to be efficient, and also allows your patients an opportunity to get comfortable with you and comfortable with what may be happening to them at their next appointment as well. I've seen patients where if you have this chance to kind of get to talk to them face to face, like we could do right now, rather than we're in the dental office and there are all these sounds and smells and things going on, and you're trying to tell them what needs to happen to their mouth, they're just not going to process it in the same way. But if you can have that patient in a safe and comfortable environment where they feel much more at ease, having a conversation about their treatment, about next steps, can be significantly improved utilizing teledentistry as well.
Great. Those all sound really valuable. Those ways to use those methods, especially with detention centers and juveniles and things like that. And, teachers have been having that first interaction, like kindergarten or first grade teachers will often meet with their students before school ever starts again to get them comfortable. So I love seeing that health providers are utilizing that way also. So that's
definitely
good. Can you go into any more about how community health clinics might be able to use teledentistry? I mean, some provide dental services, others don't.
Yes, definitely. Okay. Yeah, that's a really great question. So for our community health clinics that don't provide dental services, there might be an opportunity for you to contract with a dentist in your community who is able and willing to provide teledentistry services. What this could look like then is having that person available for, say, a virtual consultation with the medical staff. So say you have a child come in for their well child check, and the nurse, the doctor, notices that child has something weird or black in their mouth, that if there's an opportunity to do consultation with a dentist in your community via teledentistry and help triage that child and determine what might be needed, then that's a really great opportunity there. For our clinics that have dental services available, I've seen, and one of my friends in Virginia was doing this in our clinic, was she actually had, she's a dental hygienist, but she was set up in a unused medical room. So after again, children is where we usually see it embraced most in community health centers, just because of how it gets structured. But kids were coming in for, again, the well child check. And then after they finished the well child check, they were able to just hop right next door to her, and she was able to do screening, oral health screening there for the children. The goal at the health centers, they eventually wanted to be able to scale it up to this opportunity to do oral health screening and maybe even delivery of preventive services for the entire family. So rather than having that family need to move between the medical center, the dental center, have separate appointments, that there was a way to make this a little bit more streamlined for those individuals as they were coming into the health center as well. And then finally, I've seen health centers, they contract with long-term care facilities where they're able to then send a dental hygienist out to provide preventive services, utilizing school-based programs. So if you have a sealant program and you have your hygienist going to the school to do sealants, throw in some teledentistry right there. Not only are you just being able to provide those preventive services, you can again help triage those children at school. And then rather than having to do this back and forth of, well, now little Johnny's missing class 2-3 times because they're trying to get this dental treatment done. Being efficient with the preventive services while utilizing a school-based program, virtually triaging that child's needs. So that way that child is hopefully only missing, say, a day of school rather than multiple days to come back and forth for different exams with the dentist as well.
Oh, that's excellent. I'm really excited about our school-based programs and our community health centers and some of these other entities to be able to start utilizing this. It's a game changer. You know, it's a win-win for not only the patients but the dental providers as well.
It definitely is. Yes.
Let's see. So, okay, we've just put a link to the evaluation link in the chat box for you all. Again, is there any questions or anyone that would like to be unmuted to ask their question?
There are no silly questions, please. If you're thinking it, someone else probably is too. It's
Exactly. And next month we'll get into some more scenario type questions. It's more of a moderated discussion. And so we'll be able to kind of dig a little bit deeper into the different rules and regs and what can and cannot be done, things like that. But this was marvelous today, so informative. And if anyone has any questions, you have Dr. Castelaz contact information. We will have this recorded version on our website. If any friends or colleagues that you have may have missed today, they can access this recorded presentation. If you'll wait 2 weeks, if they want to wait 2 weeks, we'll have this presentation as an on-demand course where they can get CDE for it as well. So that's what's coming up. Let's see. I probably missed this question, but will they send the slides out?
I am more than happy. I know we'll have the recording available, but I'm more than happy to make my slides themselves available as well. Whatever works best for you, Beth. I'm happy to send you a copy of my slide deck. You can put it on the site too.
Okay, we can do a PDF of your slide deck and put that on there. But again, the full recordings will be available. Let's see, any other questions? Anything else? Okay, well, we'll go ahead and stop share there and change out our slides. Dr. Castelaz, thank you again so much and have a wonderful weekend. And we thank you for your time.
Thank you. Thank you everyone for taking the time to join us, and good luck. I'm excited to hear how you all start embracing teledentistry.
Oh, same here. We'll have to stay in touch for sure.
Yes.
Thank you and have a nice weekend.
Take care. Bye-bye.